As we age, it's not uncommon for doctors to prescribe medications to manage various health conditions. Whether it's for high blood pressure, diabetes, cholesterol, or other common ailments, medications are often seen as a necessary part of life. However, for many seniors in the United States, the very medications that are meant to improve their quality of life can, in fact, be contributing to serious health issues, sometimes in ways they don't realize. From dangerous drug interactions to long-term side effects, the medications you rely on could be slowly harming you without your knowledge. The problem is multifaceted prescriptions can build up over time, and with age comes a natural decline in your body's ability to process these drugs efficiently. The result is that what might have been a helpful, life-improving medication earlier in life can become a source of harm as you get older. Here's what every senior needs to know about medications, their potential dangers, and how you can protect yourself. 1. Polypharmacy. The dangers of taking multiple medications. One of the most significant risks seniors face when it comes to medications is polypharmacy, the practice of taking multiple medications at once. Many older adults are prescribed numerous medications to manage chronic conditions such as heart disease, arthritis, and diabetes. In fact, research has shown that the average senior in the United States takes 5 or more medications daily. While each medication may seem harmless on its own, taking many drugs simultaneously can lead to drug interactions that can have dangerous consequences. These interactions can alter the effectiveness of the drugs, cause harmful side effects, or even lead to life-threatening conditions. For instance, medications used to treat high blood pressure and cholesterol may interact with blood thinners or diabetes medication, leading to bleeding risks, organ damage, or heart complications. Even if your doctor carefully monitors your medications, you may still be at risk for these interactions if the drugs you take are not being reviewed regularly or if different specialists prescribe conflicting medications. It's essential to have a comprehensive list of all the medications you take, including over-the-counter drugs and supplements, and ensure that your healthcare providers are aware of all of them. Regular checkups and medication reviews are crucial to ensuring that your treatment plan remains safe and effective. 2. Side effects and long-term consequences. Another major concern with medications is their potential for long-term side effects. While the immediate benefits of medications may be clear, such as pain relief or lower blood pressure, the long-term effects can be devastating, especially if medications are taken over many years. Some medications are known to contribute to serious health problems as seniors age. For example, statins, which are commonly prescribed to lower cholesterol, can lead to muscle pain, liver damage, and even kidney failure in some people. Benzodiazepines, often prescribed for anxiety or sleep disorders, can cause memory problems, confusion, and increase the risk of falls, especially when used for long periods. Antidepressants can contribute to weight gain, sexual dysfunction, and an increased risk of diabetes and heart disease over time. Seniors are particularly vulnerable to these side effects because their bodies often have a decreased ability to process medications. The liver and kidneys, which are responsible for metabolizing and eliminating drugs, may not work as efficiently in older adults, leading to a higher concentration of drugs in the system and an increased risk of side effects. It's crucial to be aware of the potential side effects of the medications you're taking. Regular consultations with your doctor are essential to reassess the need for each medication and evaluate whether the benefits outweigh the risks. In some cases, your doctor may be able to reduce your dosage, switch you to a different medication, or recommend lifestyle changes to manage your condition without as many drugs. 3. The risks of self-medication and over-the-counter drugs. In addition to prescription medications, over-the-counter (OTC) drugs can also pose significant risks to seniors. Many older adults rely on OTC medications to manage minor health issues such as pain, indigestion, or sleep disturbances. While these drugs are generally considered safe, they can still cause serious harm if taken incorrectly, mixed with other medications, or used for long periods. For example, non-steroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen or aspirin, are commonly used for pain relief. While effective, these medications can cause stomach ulcers, kidney damage, and gastrointestinal bleeding when used frequently, especially in seniors with pre-existing health conditions like heart disease or kidney problems. Additionally, seniors often turn to herbal supplements or alternative treatments as a natural remedy for various ailments. While some supplements can be beneficial, many have not been studied extensively, and some can interact with prescription medications, leading to dangerous consequences. For instance, the herb St. John's wort, often used for depression, can interfere with medications used to treat heart disease, cancer, and HIV, rendering them less effective. Before taking any OTC medications or supplements, always consult your healthcare provider to ensure they 1. Negatively interact with your prescribed medications or worsen your health condition. It is also crucial to be cautious of the dosage and the frequency with which you take these drugs, as their cumulative effects can be harmful over time. 4. The danger of not understanding your medications. Many seniors take their medications without fully understanding what they're for or how they work. Medication non-adherence, whether it's due to forgetfulness, confusion, or misunderstanding, is a widespread issue among older adults. In some cases, seniors may not even be aware of the potential dangers of their medications. For example, medications like blood thinners, warfarin for instance, require careful monitoring and specific dietary restrictions. If you aren't aware of these requirements or don't follow them precisely, you could be at risk for dangerous side effects, such as excessive bleeding or clotting. Similarly, if you don't take your medications as prescribed or stop taking them without consulting your doctor, you may worsen your condition or cause a rebound effect that's even harder to treat. It's essential to educate yourself about each medication you take, its purpose, possible side effects, and any interactions with food or other drugs. Ask your doctor or pharmacist to explain how your medications work and what you need to watch out for. This knowledge will empower you to manage your health more effectively and make informed decisions about your care. 5. Steps to protect yourself from medication. Risks. The good news is that there are several proactive steps you can take to protect yourself from the risks of medications and ensure that your treatment plan is as safe and effective as possible. Review your medications regularly. Make a habit of reviewing your medications with your doctor at least once a year. This allows your healthcare provider to assess the continued need for each medication and make adjustments if necessary. Use a medication management system. A medication management system, such as a pill organizer or medication tracking app, can help you keep track of what to take and when. Ask questions. If your doctor prescribes a new medication, don't hesitate to ask about potential side effects, interactions, and the expected duration of treatment. Knowledge is key to preventing harm. Take medications as directed. Always follow your doctor's instructions carefully when it comes to dosages and frequency. Never stop or adjust your medications without consulting your healthcare provider. In conclusion, while medications can be life-saving and improve quality of life, they also carry risks, especially for seniors. Polypharmacy, drug interactions, long-term side effects, and self-medication all pose serious threats to your health. By staying informed, regularly reviewing your medications, and working closely with your healthcare providers, you can reduce the risks and ensure that your treatment plan is safe and effective. Never underestimate the power of knowledge and communication in managing your health. Your life may depend on it. Your health is too important to leave to chance, especially when it comes to the medications you take. Now that you understand the risks associated with medications, it's time to take control and safeguard your well-being. Here's what you can do today. Schedule a medication review with your doctor to ensure that all your prescriptions and over-the-counter drugs are necessary and safe. This is an essential step in managing polypharmacy and minimizing dangerous drug interactions. Educate yourself about each medication you take. Ask questions about side effects, long-term risks, and how each drug works. The more you know, the better equipped you'll be to make informed decisions. Stay organized with a medication management system to avoid mistakes and ensure you re-following your doctor's instructions precisely. Speak up if you have concerns. Whether it's about potential drug interactions, side effects, or the need for a medication, don't hesitate to have an open conversation with your healthcare provider. Don't wait until it's too late. Act now to take charge of your health, manage your medications wisely, and live a longer, healthier life. Your future self will thank you.